Dr. Bocking, great to have you joining us here on Politically Speaking.
Great, thank you, Jay, and thanks for having me on the show.
Tell us a bit about how your operations are impacted by having such a broad geographic area, and how do you accommodate meeting the needs of folks that are lakeshore people, rural folks, and some northern folks? You've got a real mix of geographies and differing populations there.
That's part of what makes it interesting. Public health really is rooted in communities, and to do it public health effectively, you need to understand the communities that you're serving. And so I think part of our job at HKPR District Health Unit is ensuring that we are sometimes having to tailor programs slightly differently based on different needs across those geographic areas. We do have offices, one in Northumberland County, one in the city of Kawartha Lakes, and then one also in Haliburton County. And we have staff that travel between those offices. I think some of the most recent examples I can think of related to how we adapt is when we think about the rollout of COVID-19 vaccine, and certainly the need to have some access across all of our geographic areas, but also knowing that the volume we want to see through needs to be done at larger clinics or larger venues that are often held in bigger cities. So it's a balancing act in trying to meet those needs. And it does mean that our staff are on the road a fair amount, and we need to account for that and accommodate all of our work to ensure that they're supported and safe when they're traveling to different places as well.
What was your experience with the vaccination rollout and using that unique drive-through at the fairground?
Well, so I can't take credit for the clinic at the Lindsay Exhibition Ground in early days, because that was supported through Ross Memorial Hospital. And I think that speaks a bit, though, to that vaccination rollout has been a team effort. Health units have absolutely stood up large mass immunization clinics, but we've also had clinics through hospitals. We've had large clinics through primary care teams and pharmacies. And so I think we often think to public health units, and we have continued to vaccinate for over a year now, or going on a year now, but it really has been a team effort.